Welcome, everybody. This is AJMA's first podcast. We're joined here today by Dr. Yael Halaas. And on screen, we also have myself, Zachary Hayton, and Sammy Ross. I'd like to say a big thank you to everybody who's here today. And I'd also like to say thank you to everybody who will be behind the scenes editing this video and those who are going to publish it. And yeah, so thank you, everyone. And let's get started. So today we are joined by Dr. Halaas. She is the daughter of a Cuban and Argentine parents, an Ivy League alum, a mother, and one of the top female plastic surgeons in New York City. She has a double board certification by the American Board of Otolaryngology and the American Board of Facial and Plastic Reconstructive Surgery. If all of that was not enough, she's also one of the founders of the American Jewish Medical Association, and with the goal of creating a world where medicine is practiced with excellence and compassion while respecting the dignity of all people, I'd like to invite her to tell us a little bit more about AJMA prior to talking about her journey.
Yeah, Zachary, thank you for having me, and I'm really excited that we have developed the pre-med division to this point, so we can have podcasts that will hopefully inspire many of you to go into our field and continue a really wonderful tradition. So what inspired me to start the American Jewish Medical Association? Well, first and foremost, it's kind of shocking that we didn't have it before. So many other ethnic and religious groups have medical association. There's a National Hispanic, as you mentioned. My parents are South American, Latin American. There's a Catholic Medical Association. There are a couple of Muslim ones. There's a Hindu. There's an Indian, Palestinian American. But we never had one. And considering the rich legacy of Jews in medicine, and particularly in the United States, it's a tremendous oversight. And I think we really noticed that most on October 8th when we all were reeling from the events of October 7th and realized how much hatred and anti-Semitism and misconceptions there were about the Jewish people. And unfortunately, everything that we've been seeing in universities and in schools was occurring in healthcare as well, which is really shocking, and it goes directly against the prayer of Maimonides and the Hippocratic Oath and the Geneva Pledge for physicians, where medicine should be neutral. Our livelihood is dedicated to the patient, but we didn't see that. So I think the real impetus for starting AJMA at that moment was that we really needed to have a strong, united voice. And AJMA is not just for doctors. It really needed to form for nurses, for doctors, for PAs, for chaplains at hospitals, hospital administrators, PhDs in the health sciences, veterinarians, social workers, really everybody but the psychologists had a group. So it was incredibly important that we form so we could have a voice, public health professionals, really on all fronts. We were seeing problematic behaviors. And at the same time, also, I realized we needed the Global Jewish Health Alliance so that AJMA is aligned with Jewish medical associations and other healthcare professional associations in the UK, the Israeli Medical Association, South Africa, Australia, the Canadian provinces, New Zealand, Belgium, France, Netherlands, Russia, Morocco, that throughout we were really Latin America, that we were all really working and supporting each other because, as I think you guys could personally attest to, Judaism, we're a culture, we're ethnicity, we're a religion, and we're one people, no matter where we are on this planet, no matter the shade of our skin, no matter what language we speak, we do all speak the common language of Judaism. So that is what inspired me, and we have so many different ways that we need to make an impact. One was, of course, fighting the anti-Semitism that we were seeing on every single level, from medical schools, decreased admissions for medical students, Jewish medical students in particular, and also at the other healthcare professional schools, biased journal articles, terrible statements from the American Medical Student Association, terrible resolutions and actions being brought up at our other organizations. So besides fighting, developing a curriculum for medical students in particular to educate about civil discourse, Jewish identity, anti-Semitism, and medical ethics is so crucial for all of you as you develop in your career. But we also have to be pro-Semitic. We have to be philo-Semitic. We have to celebrate who we are. How can we do well for others, to loosely quote Pirkei Avot, the ethics of our fathers? If we are only for ourselves, who are we? But the first part of that is if we are not for ourselves, if we don't know our identities and celebrate who we are, where do we find the resources to be able to help patients? And I think that's something that will come up throughout your career, is you do have to nourish yourself, be your best self, bring who you are, so that you can then take care of others and keep that resource fresh for yourself, and so that you can continuously give to your families and to your patients. So a long answer there as to why we needed AJMA and what pushed me to form it, because it didn't exist. And now we can touch a little on the professional. Being a surgeon, you guys will start seeing that there's different types of personalities that go into different fields. And surgeons tend to be doers. I do like to say that we are also thinkers. People kind of like to say we just do. But we do think, you do have to think quickly and respond quickly in a very careful manner. So being a surgeon, as you mentioned, I'm board certified in both ear, nose, and throat, also known as otolaryngology, as well as facial plastics. And that is, for me, I think is a great field, because facial plastics obviously is fun and pretty and really puts a public face on things. And really, I was an art history major at Columbia for undergrad. So it really weds together the concepts of beauty with science. And being a geek, what a perfect combination. So you get to enjoy both. And it's also just a very happy field. You're helping others. And the way to it, facial plastics, is usually if I'm doing an ENT head and neck surgery residency. And I love that field also because it's a combination. You can have medical care. You can be dealing with allergies. You can be dealing with ear infections, with throats. But it can also be really anatomical surgery, like thyroid surgery, head and neck cancer surgery, really life-saving interventions. It can also be ear surgery, which is more similar to neurosurgery, very detailed, and often you are working with neurosurgeons because the ear is a pathway into the brain. So that is another very interesting area that you can work in. You can do pediatrics. There's such a wide variety that when you go into ENT, it is extremely competitive. And so I mean, you guys are all used to that. To get into medical school now, is extremely competitive. So it's just continuing that pathway of trying to be the best always. But then when you're in it, there's still so many different things that you can do. And I love facial plastics. It's a pleasure. I personally like also to do a lot of research. And so I can kind of combine innovative health tech research with facial plastic surgery or minimally invasive, so that we can look the best and have our outer shell reflecting the beauty of our inner souls.
Well, that's all amazing, and we're so happy to have you here today, and we're so grateful that you've started AJMA as a way to connect Jewish healthcare professionals with other Jewish healthcare professionals. And despite having only started within the last 3 years, it has so much potential, and I look forward to seeing where the organization can grow. So like you had just mentioned a little bit about your specialty, I want to take a step back real quick, and I want to talk about your journey and how you got to where you are today. We mentioned earlier that you come from a family of people from South America. And I'd like to ask, we have so many people that when they're applying to medical school, they have such diverse backgrounds, whether they come from South America or, other places all across the globe. And many of them have stories that are sort of like, this is what clicked because I grew up here. This is an experience I had. And, this is what fostered my love for medicine. So I'm curious, did you have a similar experience?
Yeah, great question. Thank you. My mother, who is from Argentina, is a pediatrician. And it's often said about medicine that it's almost like a religion. So many people go into medicine because someone in their family was in medicine. And almost kind of similar to Judaism, we follow in the footsteps of our forefathers. And in this case, it's of my mother. So she graduated medical school at the University of Buenos Aires in the 1950s, 1960s in Argentina. And it was interesting because at that time, Argentina was actually graduating more female physician graduates than the United States was. So they were a little bit farther along. But there still was major struggles, to be a woman in the field. And even in my training, there still was definitely a difference, and it was noted whether you were a female resident or a male resident. So I would definitely say that my mother was a tremendous role model for me. She graduated from medical school in Argentina and flew up to the United States to do her residency in pediatrics here. She faced multiple challenges. She was a new immigrant. She was Hispanic, or is Hispanic, and that was very different than people training at that time. She was a woman. She actually was interested in doing pediatric surgery, and she started on the path, and then they came to her and said, oh, we were able to find a man to fill the position. So continue in pediatrics because that's, a nice field for a woman. So some things that hopefully people aren't hearing now, but it is pretty fantastic to have a mom who's a pediatrician. She really can care for you in so many ways. Besides being a mom, she's a professional children's doctor. And it really made for a really great grandmother to have a multilingual driving pediatrician who lived nearby. And she really inspired me. And I think that when you tell your story, when you're applying to medical schools, and when you are going to be dealing with patients, it is important to bring your authentic self and bring in all the different ways of who you are and how that's going to impact your practice and why you want to go into the field. I would say that particularly when you're applying to medical school, they want a complete, intelligent story as to why you are you and what you are bringing to the medical school and the medical profession. So I would not recommend hiding your background. I would highlight all the different features that we have because it does give a complete story, and you want it to be authentic. And that's really what gets conveyed in interviews. And you guys all have been in competitive colleges and had gone through that process. So bringing that full story forward really will show your integrity and what you're bringing to the table, the multifaceted you.
Well, and I think that's great advice. We see all these videos, and whether they're on Instagram or other platforms on social media, all of them are be your unique self, show them who you really are, and they always say show, don't tell. Show who you are as a person. Don't just tell them all the extra stuff that you've done. What does it really mean?
Mm-hmm.
And I'd like to touch on something that you mentioned. Your mother became a pediatrician in the early 50s, where there was a lot of stigma around women in medicine. And still to this day, we do see a lot of stigma for women in medicine. Can you talk a little bit, have you had any negative experiences? What do you recommend to women that are considering careers in medicine? How can they be successful and make themselves stand out?
Yeah, I would be happy to. So, more and more we're seeing that medicine has more female representation. A lot of the medical schools actually have slightly more women than men. So I think a lot of the challenges are being overcome. And particularly in medicine, there's a lot of times the word equity is thrown around. Of course, we want health equity. We want everyone to be doing well. You want all of your patients to have good outcomes. So that's, that's a way that word is very impactful. There's other areas where equity is important, such as pay equity. And that's where if you have a woman or a man doing the exact same job, the exact same amount of work, there should be pay equity. So in the surgical fields, we still do see that there are more men than women. And I think that that's partially a consideration for lifestyle. I think we see less of that. But lifestyle is an issue, and I think that does drive choices into career goals. There's no question that surgical training is longer, and the hours, particularly there was a time where they really weren't regulating the hours. There were weekends that I would enter it on Friday, and I would go home Friday morning at 6 a.m. and I would go home Monday, maybe 9 p.m., having been on call and working that entire time. That does take a toll. It doesn't allow for much of a social life. And it is demanding, and it makes it hard to, to consideration to when you want to have kids. No matter what, there is a biological factor that you have to put into account there, that you're going to have kids at some point, and carry the kids and give birth to the kids and breastfeed the kids. So it definitely is a challenge. I mean, having a female role model like my mother, who worked incredibly hard and worked incredibly long hours to support us, did allow me to see, kind of in a pre-feminist era, that it could be done, and has been done throughout time. I mean, women work. Women do a lot of work, whether it's with a big title or not. So she was able to raise us and very clearly have her influence on us. Though it takes a village. So I think there's definitely some considerations. Kind of on that topic, when I was a surgical resident, my attending surgeon said, "Yael, don't even dream about getting pregnant. That's not so cool." It absolutely can be done, and it can be done on all levels. You can be a successful wife or partner. You can be a successful mother. You can be a successful surgeon. You can be a successful business person. Particularly facial plastic surgery is still a very entrepreneurial field. So you can accomplish all of those things. I won't lie. It's not possible to do everything yourself. It takes a village. And if you can, find a mom who's a pediatrician. That's really good. That's a big helper. But yeah.
That's all amazing. And we'll touch on that again later. You mentioned that you're an entrepreneur, you're a business owner. And I want to come back to that towards the end, and talk about kind of how you got to that point. What was the decision there? Also, how did you manage raising 3 kids and doing all the incredible stuff that you've done all along the way? Prior to getting there, I want to talk a little bit about something that many pre-meds and medical students struggle with, and that's just the sheer rigor of being in those shoes. A lot of students and medical professionals themselves face burnout. Many face it prior to even getting to the point of having their doctorate. So I want to ask, is it something you faced? Is it something you see common in the people in medical fields around you and the professionals that you work with? And can you recommend anything to maybe not avoid, but deal with what's such a common issue?
Yeah, I think that's a real issue and needs to be addressed in a couple of ways. Medicine is a grueling endeavor. It's a long endeavor. You're going to graduate from college, and a lot of your friends are going to go out and get jobs, and some may, particularly if they go into the finance world, law school, extremely rigorous, extremely long hours. Some not. Some are going to take other positions, but they're going to actually start living life. They're going to start making a salary. Medical school, there's a few now that are 3 years, but otherwise medical school is 4 years, and you're still not done. Then you have to do residency. And the hours have been a little bit better now because they regulate them a bit and the pay has gone up. But it's still not the same as to maybe some of your friends. If you're getting into medical school, obviously you're competitive and doing well. And some of your friends are going to be going into careers where they're going to be compensated better. So it's a long road. And again, a bit like what I was saying earlier about being a religion. It's something that it's a feeling that you have, you're inspired to do, and you feel like you must do it. That being said, you have to also love it. And my father always used to say that if you love your work, you're never working a day in your life. Also, if you love who you work with. So it's incredibly important that you really truly have a calling, that you really truly find fulfillment, and that you cannot find fulfillment in a different way because there are so much easier ways to make a living. There really is something so incredibly satisfying to helping another human being, particularly in a time of need. In facial plastics, maybe it's a time of anxiety or aging, or they're planning for a wedding. So there's something that's just so deeply satisfying about being needed in that way and being able to help in that way. That being said, there is, again, the long hours. So you have to continuously find ways to kind of fill your own cup. So be it skiing or horseback riding or going to the gym or having coffee with friends or being with a loved one, you do continuously need to find what it is that reinvigorates you. So you're not continuously just pouring out from yourself. It's also important to pick a field that you do really love and do find interesting, because that can continuously renew you. And there are some fields that are known to have a little bit more burnout than others. So if you're choosing one of those fields, then you do have to make sure that you're balancing that time. I think another thing that really gives people burnout is kind of loss of control over their own hours or over the financial concerns. So medicine has turned more into kind of an employer-employee relationship. A lot of practices have been bought out. You're not really functioning independently. There's a lot of pressures to work in a certain way and produce output, almost like a factory worker. Like, you need to see these many patients, you need to use these codes, they need to only stay for 5 days. Like, there are kind of like rules, and maybe we're going to see that more with AI. On the other hand, we might have like really cool new ways of treating people and interacting with them because of AI. We will kind of know and have more specificity. So it's kind of like an incredible growth opportunity as well, and to still have that human connection and interaction. For me, continuously learning, having these new opportunities, doing aesthetic research, working with some of the largest companies out there, finding what's going to be new is really invigorating. And you have to remember that in medicine, you're still in science. There's still such a tie-in to like basic science and computer science and AI. And there's so many different ways that you can still develop new things. So you have to refill that cup. You have to like reinvigorate yourself. Find the things that are going to help to drive you forward. If it's entrepreneurial, facial plastics is entrepreneurial. So, new business, marketing things. That's for me the way to avoid burnout, is just recognizing that you have to refill your cup periodically.
Yeah, well, there's definitely something for everybody, and a lot of people start with something and decide it's not for them and switch later on. But, in a field like medicine, it's hard to go down, 4 years of undergrad, 4 years of medical school, and then start a residency and decide, well, wow, this isn't what I want to do. Where can I pivot from here? You mentioned the 4 years of undergrad followed by 3 or 4 years of medical school, and then however many years of residency, depending on your specialty. What was your career path from undergrad to through residency and fellowship? What did it look like? What did you love about it? What did you hate about it? Were there things that you did outside of studying that kind of kept you on your toes and kept you going?
Yeah, I'll give you the play-by-play. We'll go back in time. So I grew up in Scarsdale, New York. It's a suburb in Westchester. Uh, I graduated high school, went to Columbia College, Columbia undergrad. I was an art history major and was pre-med at the same time. So at that point, I think what was kind of refilling my cup and keeping me excited to keep going with medicine was that the art history was just like another part of your brain, to exercise and keep in touch with humanity and history and expression. During college, I did clinical hours at Memorial Sloan Kettering. I did in pediatrics. I started working in pediatric neurology, did a summer doing pediatric neurology research, and actually got to be on a publication, so that was amazing. I graduated Columbia in 3.5 years, and in that half year, that second half, I went back to the pediatric neurology lab and the epidemiological research that we were doing. So I sort of was living on campus, and Columbia didn't even notice that I was still living there, even though I had graduated. And I was just commuting every day to the lab or to the office, and grew tumors on the back of nude mice, and then zapped it off with different lasers. So theme that would carry on to later in life. And was doing also the clinical research as well. So obviously had to study and do very well. I did environmental activism while at Columbia. So kept, some other interests besides the sciences. Did well, obviously, got into Cornell Medical School. And definitely in medical school, I would say things really came together. That's where everything just started to seem to flow together. I mean, right now you guys are taking like orgo and bio, and it's like, how does this like even make sense? And what it seems like it's a long way from the body, it's not. And it all kind of just flows together in medical school. It just starts to coalesce. And the more that you can draw on that, on all of those skills, you need to have the people skills. I would say art history actually probably really was very helpful for gross anatomy, for really understanding anatomy and pathology, because I kind of felt like I had a visual on here's the liver and here's the artery and it's flowing in, and it kind of just gave you a conceptual space of everything kind of integrating and working together. And then going on to the clinical gears, really felt like I was in the right place. All of the pieces were coming together. This needs to happen for that to happen. How could we be the most efficient, managing, balancing all of the different patients, rounds, physical skills, operating, learning to suture, interacting with patients, and that human connection. So I really felt like I could hear a symphony playing. It's hard to know what field you start going through the rotations. You do, usually if you have any inkling you're going to do surgery, you kind of do your surgery rotations early on, and you get some choices. You get to rotate through different areas. It's definitely, I kind of knew I wanted to do something with my hand, so I did that earlier on to just make sure I wasn't excluding that as a possibility. And again, ENT really kind of allowed me to postpone the decision on what I actually wanted to do, because doing ENT, I could have gone into head and neck surgery and been a cancer surgeon. I could have gone into pediatrics and done surgery, but also, interacting with children. I could have done a regular general adult ENT. If I was feeling more neurosurgical, well, that's otolaryngology, that's otology, that's ear surgery, where you're actually working with, often have a dual appointment with neurosurgery, because you're helping approach access to the brain, vestibular schwannomas and tumors, or facial plastics. So that is sort of the actual path that I took. And I did do in residency some research in the ENT field to introduce me to the field a bit more, and make the resume look a little more prestigious, get a couple of more publications under the belt.
A lot of pre-meds and med students are trying to make names for themselves. Obviously, still have to do well academically, still have to do well on your standardized testing. Having those experiences, whether they be research or clinical, those or volunteer or community service, they really shape who you are and what you can talk about and what you can do. Obviously, you've gone down this whole career path, this path that a lot of us are about to head down. If you could go back and change something, is there something in particular you would change? Are you happy with how you did it? And is there something that like you think would have been better off one way that turned a different way, or vice versa?
I'm happy, absolutely, with what I've accomplished and what I built. So after my ENT residency, did my facial plastics fellowship and uh, built my own practice. It's, daunting. You really do have to have drive and spirit, and I have loved my practice. My advice to all of you is to realize how much you can accomplish. Bet on yourselves. That's probably my big advice. That was the advice that was given to me before I set up my practice is bet on yourself. It's the best investment you can ever make. And if I was to do it differently, maybe realize just how much, and in particular, even more in modern times, how much you can actually develop and start and do, even younger and younger. Because particularly with like social media, you really could develop something. You could develop an app. You could, build a huge social media presence. You can dream and accomplish things even more than you can realize. In medicine, we tend to be very like stepwise. You have to do this, then you have to do this, you have to do that. And you do. But there are other things that you can do surrounding that to kind of encompass more of who you are as a person. And it doesn't have to hold you back. Like you can start an app that maybe will help something. You could create a program to help people or work with disadvantaged children or bring healthcare to an underserved population anywhere on the globe. It's kind of amazing how much one can actually do, how much you can accomplish, and what skill sets you have or could quickly learn and accomplish.
Well, I think that's all great advice, and we're living in an ever-changing world, especially in terms of technology and AI, and all of that. It is important to, have a grasp on what you can do, and maybe even what you want to do early on, and kind of get the ball rolling, because it can only be beneficial to start before. We mentioned your specialty and that you are one of the top plastic surgeons in New York City. I'm curious, in this ever-changing world where we have new technology and AI and things like that, what does it mean for you as a physician to now have all this new technology and opportunities for things to do?
Well, it's still coming. A lot of it is still being developed. Currently how it manifests is patients will come in and say, AI said I need this done to have a more perfect face. Okay. Um, Fortunately, AI and I often seem to agree on what that plan is. Um, but I think it's going to be developing even more. We're seeing AI being used to read lesions on the skin and to determine which are cancerous and not cancerous. So that's kind of amazing. That can then be put together with lasers for treatment. So if you can put in all of this incredible amount of information, plus all the different parameters that lasers can have, then you can really improve better treatments and help carry them out as well. So that's where I think aesthetically it's going to develop more, at least for my field. We haven't gotten to the point yet that AI robots are doing surgeries. That will be interesting. That will be an interesting time. But I think AI as a tool to help physicians run their practices. And definitely, I think for a lot of the other diagnostic fields, certainly radiology, things are being able to be read faster and earlier with assessment of data so that you can correlate what you're finding versus what the outcomes could potentially be. And that's going to be applied also for cardiology, for all sorts of different fields. And it'll be interesting to see how that gets integrated. It's not being done yet, but these are literally things that you guys could be help developing, how that could be integrated into someone's total lifestyle. So that's an exciting future, step by step.
Well, there's definitely more to come, and it's all going to be relatively quick. So I'd actually like to pass it off over to Sammy to talk a little bit more about your specialty as well as your practice, and kind of what it means to own your own practice, and maybe even how you use some of these new tools in your everyday life. Sammy, you're up. Thank you.
I just wanted to say thank you again for coming on. And I wanted to start off with your uh, quote that you said about betting on yourself. So when you decided to open up your own practice, what were some of the obstacles that you had to go through at the beginning of your career? And then uh, was there a time when you really felt like lost and you were ready to give up on that? Were there like things that kept you going? Also, you're in New York City, which is extremely competitive as is. So tell me a bit about what that was like.
Yeah. I so I did my ENT residency, then I did my facial plastics fellowship, which was in New York and New Jersey area. So I was local. It's a big step to open your own practice. You're always going to have different points in your life, different forks in the road, where you can kind of be your own employee, start something on your own, or you can join. You can join a hospital system. You can join a practice. There's going to be these forks in the roads that you have to decide. Facial plastics and plastic surgery in general is kind of still an area where you can either join or still maybe bet on yourself and open up your own shop, which can be expensive. You also have to make sure that you can pay your own bills. That was something. I was going to have my first child. My husband was still in training, so definitely had to live leanly and make sure that I had jobs to help support starting the practice. So that was a real challenge, to just feel that you could do that, and hiring employees at the beginning who you can hire. You may not be able to hire a full team. So you really have to kind of grow step by step. I hadn't thought about it till you asked. That there never was a point that I felt burned out. There never was a point that I wanted to go back, or as you were saying, thought it wasn't the right path. There definitely were many times of being challenged. There's definitely many times of taking call and being really tired and wanting to spend more time at home or with kids. But I mean, I have to say, looking back, that I love what I do, and I've always loved it. And even the challenges have been worthwhile because it continues to grow. So I'm glad I did what I did. And do I think that is for everyone? New York is, you're right, is very competitive.
Yeah.
If you can be successful there, I guess, right, you can be successful anywhere. Uh, Fortunately, New York is large, so there's certainly plenty of niches and patients that could support many different practices. Maybe it would be easier to be in a less competitive market, uh, but that gets back to, bet on yourself, bet that you can bring something, do something, provide something that is going to make you unique and make you stand out, even in the largest city in the world.
Mhm. And so you mentioned again, like that never having a feeling of burnout. And I think that really speaks to what you said about wanting to do medicine and feeling like there is nothing that you would get the same satisfaction as going day in and day out, helping other people and making their lives better. So I think that really encapsulates, the fact about that this was meant for you and this is something that you love. And even though there were those struggles along the way and other great things in your life that you want to tend to in those tough times, it's important for everyone to continue going and continue on the long path and get to where they want to be. You also mentioned about dealing with uh, joining a hospital versus owning your own private practice, and also that employer-employee relationship that in the past few years with insurance companies has become even greater. So how have you managed that, and also dealing with other competitors? Like, can you walk us through that? Have you learned, You've definitely learned a lot on the business side as well, having owned your own practice. And do you have some advice in that sense, more on the fiscal side of it?
Yeah, I mean, I think it really kind of depends on what field that you go into, because some fields like interventional radiology or cardiothoracic surgery, you do need to be in a hospital setting, or certainly very closely tied to one. There are some professions within medicine that you do have to stay kind of close to be hospital based. Also, if you're interested in academics, you do want to stay at kind of a major institution. So that's a little bit determined on what your interests are. Do you want to be in a community practice? Do you want to be in an academic center? And that will determine a bit your salary structure and how you're getting paid. I mean, something that's developed in this country and it exists in some form in all countries, because some countries have socialized medicine, is networks. Even if you are out on your own, you have to deal with insurance and you have to deal with insurance networks. So that sort of takes away some of the entrepreneurial capabilities, because you have to follow these guidelines. You have to submit a lot of paperwork. Referrals have to go in a certain way. So those are definitely challenges. There's still opportunities out there. There's still some private practices or practices that doctors are uniting together. The doctor alone, you're not seeing quite so much. There's also, there may be ability to develop your own models. Just because it hasn't been formed yet, you could, but there has to be sort of a strength in numbers type situation for that. I see this a bit more in New York. There is the whole concierge medicine pathway, where doctors go out of network. And when you've developed a certain level of prestige, esteem, respect, that patients will choose you. And it's a different type of system. Sometimes that you're working in a group and they're choosing the group, or they're just electing to go to you individually out of network. And they're willing to pay for your specific services that are kind of outside the norm. Like a lot of these concierge medical groups maybe do personalized medicine, or have extra nutrition or rejuvenation things that work in complement with the aesthetics.
Yeah. And so you mentioned like having that team, and also the presence of being on the academic side of it as well, and how, medicine is science at the end of the day, and there are always new things to be learned and new discoveries to be made. And you've been a part of many of those. So can you speak about how you've gone about forming the team that you have now alongside you, and how you've gone about getting those research publications out and getting grant money, and that whole process, while still being in a private practice rather than having a university funded system for research and things like that?
Yeah. Okay. Very, very good question. And so it is unusual that in a entrepreneurial facial plastic surgery private practice setting that we do as many studies as we do. It's not unheard of, particularly in the core aesthetic fields, to have involvement like mine. It does take extra time, and it takes time from your staff as well. So you do really have to have staff that's capable of doing studies. The studies that I do tend not to be grant related. They tend to be working with industry. So I wouldn't put it exactly in the same category as academic medicine, where you're really applying for grants. And I like to think that no matter what research you do, you are unbiased and remaining unbiased, whether it's funded by industry or an individual grant or by an institution. How did I develop doing it? It's just they found me, I found them. Just having that level of interest. I think I started attending meetings as a resident, And so started having that interaction. Also, I started doing research that sort of was in that field. So it just built on itself. And that's how I would recommend it for others. I mean, we all stand on the shoulders of giants. We stand on what maybe many of our mentors had been doing before us. So there's definitely in medicine role models that we grow and learn and replicate.
When you're on that path, there are oftentimes mentors and people that you learn the way that you practice now from, and there are people that have been very close and integral to your path in medicine. Do you have advice for pre-med students when they're looking for those clinical opportunities and when they're looking for those research opportunities? You said oftentimes it comes from just attending those meetings and being at those talks and interacting with those people that you want. So like, what are some recommendations? Because everyone just says, email, email, email. But face-to-face interactions have become so much less common nowadays. And I think it takes away some of the true human interaction. So do you have any recommendations for undergrads that are looking for those mentors and looking to find that clinical experience and dip their feet in and know that this is a field or this is the specialty that they want?
Yeah, so that's, I would say there are so many things that AJMA are doing, but one of
Yeah.
the areas that I so often see people asking for help with is young medical students and healthcare professional pre-students looking for those kind of opportunities. So I think that's also one of the reasons why AJMA really needed to exist, is so that we could have that mentorship structure built out, and so that we can ask our members, do you have opportunities to have students working with you, shadowing you, participating in your clinical research? So I think that's really one of the most valuable, important networks that we can have. I agree with you. There's something particularly special about going in and meeting somebody so they can actually see who you are and what they do. I really hope AJMA will help continue to facilitate that as we grow. We've been doing that more and more. And it just, sometimes it just means like just pounding the pavement, going to the meetings, going into the departments, and introducing yourself and saying, oh, this study looks, really interesting. What is the area or fields that I want? And then having skills that could be useful. Know how to do Excel, know how to work well with Canva. All of those things make you an integral part of the team. So even though you're a young or early member or a potential member, you're showing skills that could be used to help. Even being able to do a good med lit search on a topic.
Thank you. Yeah. So I'm going to pass it back over to Zach now. I appreciate all of the advice that you gave to medical students, and it was great to get a vision into how you have paved your way through medicine. And I just want to say again that it's very amazing what you've done, both in your own practice and building AJMA to what it is now. And that network that you mentioned will be so valuable for the future of Jews in medicine. So thank you so much for your time.
Thank you, Sammy.
Sammy, thank you very much. Dr. Halaas, we've learned so much about you as well as so much about the AJMA. And one last question before we end, I'd like to ask is, you've accomplished so much being a mother, being a doctor, being a fighter against anti-Semitism, and an entrepreneur. What can we expect next? Is there something that we should look forward to?
Growing everything in every direction, more and more, both in my private practice. Who knows? Maybe you guys will be future members of Science and Beauty, and that's my practice name. So really growing more because, again, there's so many interesting things happening. So I would say that would be something, expansion and not just technologies, but with great great staff and great other healthcare clinicians. Um, and more and more from AJMA. We really needed to have this large medical association and building the network more and supporting the next generation. So
Yeah, well, we're all very excited to see what will be done within the next year and within the next 5 or even 10 years, both in medicine as well as in the Jewish community and within AJMA. So we're so happy you were here today, and we were so happy that we had the opportunity to interview you and get to know a little bit more about you and about the organization. If people want to reach out and have questions, what's a good contact they can reach out to?
yeah, just you can just go to the AJMA website, which is actually theajma.org. And you can actually just do info, or you can reach out to me directly at yhalas, YHALAAS at theajma.org. Or if you, for facial plastics, go to my website, www.drhalaas.com. So, two ways to get me.
Well,
Two.
thank you so much, and we are so happy to have you here, and we look forward to talking to you again soon.
Okay, take care, guys.
All right, you
Thanks
too.
for coming. Have a great day.
Bye.